Hello everyone. So today I'm going to be explaining about how to wear neck collars and why are neck collars needed. So neck collars are also medically known as cervical collars or neck braces or C collars. And these collars are used for support to our spinal cord and head. These collars are a common treatment option for neck injuries, neck surgeries, and some instances of neck pain. There are different types of cervical collars which we will need will depend on our type of neck injury or the underlying cause of our neck pain. So, what are cervical collars used for? So, the purpose of a cervical collar is to support our neck and spinal cord. It is also to limit the movement of our neck and head. So, in instances of a very severe injury, it can prevent us from further injuring ourselves. So this is typically meant for a short-term use while we recover from an injury, surgery or pain. So some conditions that may require the use of a cervical collar are whiplash and trauma. So let's say if we've been in a car accident or sustained some other kind of injury like a fall, a cervical collar may protect our neck and prevent further injury. Neck surgery. A cervical collar helps to prevent injury after surgery by limiting rotation as well as side to side and back and forth movement. Nerve compressions are also another reason why we should have a cervical collar, because cervical collars are occasionally used to reduce pressure on the nerves of the neck. And cervical spondylosis. So a cervical collar may cause temporary relief from pain caused by cervical spondylosis, which is an age-related condition that's caused by a wear and tear of cartilage and bones in the neck area. And lastly, neck collars are used to relieve general neck pain or stiffness, which can help take some strain off our neck muscles. So as said, there are different types of cervical collars. So cervical collars come in soft and hard varieties. Soft collars are usually made from materials such as felt, foam or rubber, and they fit snugly around our neck and sit below our jaw. And some doctors may prescribe them for temporary relief from moderate neck pain. So soft collars are unlikely to help manage more serious neck injuries. On the other hand, we have hard collars, which are usually made from plexiglass or plastic, and they restrict head rotation and side-to-side movement more than softer collars. So they often have a chin support to allow the muscles in your neck to relax. Hard neck braces are often prescribed for severe neck pain, spinal fractures, and trauma injuries. So there are questions that arise like, are there side effects to wearing a cervical collar? Although cervical collars can help support and protect our neck in the short term, researchers have shown that long-term use of cervical collar may lead to a weakening and stiffening of our neck muscle. So in cases of acute injury, it is largely unavoidable. However, if you're dealing with a moderate neck pain, try to minimize using the amount of time we wear a neck collar, and we can take pills to reduce the pain. So there are certain tips for wearing a cervical collar for a patient. So if you are needed to wear a cervical collar, usually healthcare providers will give specific instruction about what we should and shouldn't do while wearing. For instance, we should move instead of resting or sitting too much, focus on good posture, avoid sitting in soft and low chairs, avoid lifting or carrying anything heavy, leave our collar on at all times except when cleaning it or directed by our practitioner. Make sure our collar fits tightly but it is comfortable. The procedures of wearing a neck collar is that when we have to lie flat in a bed without a pillow, keep our head in a neutral position. Do not bend your neck forward or backward from side to side. And then before removing the collar, we should note where the end of the Velcro straps are. So when we put the collar back on, the strap should be in the same position. So first we have to undo the Velcro strap, remove the front of the collar and the side back panel and out from under the neck. And then when we want to replace the collar when we are lying down, we should slide the back panel carefully behind the neck and make sure it is centered evenly. Long hair should be placed outside of the collar. Flare the sides of the front panel, slide it up the chest wall and scoop it up under the chin, making sure it is central. The sides of front section of the collar should be directed up to fit snugly over the shoulders and wrap it around the back of the neck. Attach the bag straps to the front one at a time until they are in original position. That is all from me today. Thank you so much for listening.